Good day. I'm going to be talking to you about HIV and AIDS and the aging. What if I were to ask you, what age group did you think that HIV and AIDS was the most prevalent? Of course, most of you would say either homosexual, gay men, or young adults that refuse to use condoms as sexual intercourse protection. But then, what if I were to tell you that your parents or your grandparents are potentially infected with HIV and AIDS? That would stun you, right? Well, according to the CDC, the NHI, and according to Saxon, Etton, and Perkins, pages 259 to 260, half of the population with living with AIDS or HIV in the United States are 50 years old and older. Many of them were diagnosed at an earlier age. Signs and symptoms may include with early onset headaches, fever, flu-like symptoms, sore throat, chills, sweats, mouth ulcers. Latent stages can include diarrhea, loss of appetite, weight loss, swollen glands, blotches on the skin and the nose and the eyes and behind the eyelids, diarrhea, recurrent yeast infections. By 2020, though, the CDC says that 65 to 70% of people living with HIV or AIDS in the United States will be 50 and older. That's a high percentage. So HIV and AIDS was predominantly came around in the 1980s. And it was thought of as a gay man's disease. According to the Gay Men's Health Crisis Incorporated 2010, they said that HIV and AIDS has increased in the older population because of the decreased use of condoms during sexual intercourse. And condom usage is rarely used in the older men because of their problem with erectile dysfunction. The Gay Men's Health Crisis as well said that HIV is not a gay disease, but gay people are disproportionately affected by HIV and AIDS. Gay and bisexual men or men to men contact have sex with men. There's also a group of men that do not claim themselves to be gay, but they do have tendencies to sleep with men. They consider themselves MSM. They don't say they're gay, they don't say they're bisexual, but they have sexual tendencies with men. I don't know, go figure. So, CDC has a diagnostic ranges for ages that have HIV or AIDS. So with the population that has it, they said that age from 50 to 54, at least 38% have it. From 55 to 59, there's 29% of the population with it. And from 60 to 64, 18%. And 65 and over, 16%. That's pretty high for 65 and over. That's when you think those older people aren't having sex. They are, but they need to be educated and informed. So from 2011 to 2016, there was an increased percentage of 57% for the age of 65 and older. That's 57% 65 and older. They need to be educated. The CDC said in 2016, 67% of diagnoses were among male-to-male contact. That's male-to-male contact, 67% increase. 86% of females contacted it through heterosexual intercourse. So those men that were saying they were straight with those women obviously were not. 86% of women were infected by men that had men-to-men contact. Men have a 72% increase in diagnosis of HIV, and they have a diagnosis of 3 times more than that of females. That's 3 times more than that of females. So, women need to be more cautious. The statistics that came out leads me to believe, or anyone to believe, that it's because men are not protecting themselves. Even if they are gay, they can still protect themselves or give women the heads up that they are bisexual. So the spread, according to the CDC, usually comes from drug uses, IV needle sharing of any kind, male-to-male sexual contact, homosexual, heterosexual, non-protected sex without the use of condoms, unsuspecting menopausal women sleeping with men that they have no idea are bisexual or gay, and blood transfusions. The NHI said that older women refuse to use condoms because they don't fear getting pregnant. That's the education part that they need, because they have no idea. Of course, they can't get pregnant, but they're not realizing what else they can get. They can get something that they can't get back. So they need to be educated. So in order to assist in protection and to decrease the percentage of older population getting it, education is key. We need to educate them on condoms, educate them on protecting themselves during sexual intercourse, regardless of who it is, male, female, somebody says it's straight or not, they need to still have it. If they're sexually active, they need to be checked regularly by their doctor. And each one of us needs to actually talk to our older relatives or parents just to get them comfortable with sexual talks. Just a reminder, no one is exempt of getting HIV or AIDS, and although it was once thought of as a homosexual or gay disease, statistics let us know that it no longer is. The population of the age of 50 years old and older, the increase of infection is like half of the population. So in wrapping up, no pun intended, but wrap up, I urge you to get your loved ones checked out or assist them in getting educated. And just to let you know that the greatest number attaining the disease is men-to-men contact with 67%. 86% are women getting it from heterosexual contact through sexual contact that's not protected. So what I need you to do is inform your aging loved ones so that they can be around a lot longer. Be careful, be safe, and take care.